There comes a time in life when strength means something different. Not the kind of strength that lifts weights, but the strength that lets you lie still on a hospital bed and trust. After 70, surgery isn't just a medical event, it's a spiritual and emotional journey. It requires faith in your doctors, in your body, and in time itself. But surgery at this age carries unique risks. The body doesn't heal the same. The immune system is more fragile. And the smallest oversight mentally, emotionally, physically can turn into a big complication. So today, we share with you the 5 essential truths you must know before going under the knife in your 70s. These are not textbook facts. These are life-won insights. Truths gathered from doctors, caregivers, patients, and families. They could save your life. Or the life of someone you love. Number 1. Your mindset is a healing tool, more powerful than any medicine. Let us begin with the most underestimated factor in surgery recovery, your mindset. We often ask, what's your blood pressure, your glucose level? But rarely do doctors ask, what's your emotional state right now? Fear is natural. So is anxiety. But if left unchecked, they can weaken your immune system, slow your healing, and increase post-operative complications. Let us take James, a 73-year-old retired teacher. He went into surgery for a hip replacement with severe anxiety. He barely slept the week before. He didn't tell anyone how scared he really was. He wanted to stay strong. Post-surgery, James developed complications, poor appetite, slow wound healing, and depressive symptoms. The doctors treated the symptoms but not the root cause, unaddressed emotional stress. Compare that to Linda, 75, who had heart surgery. She practiced deep breathing, spoke openly with her family, wrote in a journal, and even visualized herself walking in her garden again. She bounced back in record time. Mindset matters. Here's what you can do: acknowledge your fear, don't hide it. Say it aloud. Share it. Meditation and breathing exercises, just 5 minutes a day, calms your nervous system. Affirmations: say, I am safe. My body knows how to heal. I am supported. Talk to someone, a therapist, a counselor, or a spiritual guide. Watch your words, speak with hope, not despair. Words shape the body's chemistry. Healing begins in the mind. When your thoughts are aligned with recovery, your body follows. Number 2. Nutrition before surgery is like fuel before a journey. You wouldn't drive across the country on an empty tank, would you? Then don't go into surgery without the right nutritional fuel. The truth is, many people over 70 are silently malnourished. They may not look thin. They may eat 3 meals a day. But their bodies are often low in key nutrients needed to repair tissue, fight infection, and sustain energy. Before surgery, you must prepare your body like an athlete prepares for a race. What does that mean? 1. Prioritize protein. Protein is what your body uses to rebuild muscle and tissue. After surgery, your body demands more protein than usual. Eggs, chicken, tofu, lentils, Greek yogurt. Protein shakes, low sugar, doctor approved. Start boosting your protein 2 to 4 weeks before surgery. 2. Check your vitamin D and calcium. Bone surgeries like knee or spine procedures heal slower when vitamin D is low. Get your levels checked. Ask about supplements. 3. Iron and B12 matter. Anemia slows healing. It makes you tired, weak, and prone to infection. Eat leafy greens, organ meats, or take supplements after checking with your doctor. 4. Hydration is essential. Many older adults are chronically dehydrated. This affects your blood pressure, kidney function, and healing. Drink water regularly. Aim for 6 to 8 cups unless your doctor says otherwise. 5. Avoid tea and toast meals. Simple carbs and low-protein snacks aren't enough. You need real, nutrient-dense food. Remember, you're preparing your body for a storm. And your food is your armor. Number 3. Prehab is the new rehab. Train before the surgery. You've heard of rehab after surgery. But what if we told you the real secret lies in preparing before? It's called prehabilitation, and it's changing lives. Studies show that elderly patients who do simple physical therapy before surgery have fewer complications, recover faster, stay in the hospital for less time, walk again sooner, and regain independence more quickly. What kind of exercises help? Deep breathing, expand your lungs, prevent pneumonia. Practice holding your breath for a few seconds, slowly exhaling. Leg raises and chair stands, build leg strength to reduce fall risk. Light walking or cycling, improves blood flow and stamina. Balance drills, stand on one foot with support for 10 seconds. This builds confidence post-surgery. Even just 15 minutes a day for 2 to 3 weeks makes a major difference. Think of prehab as physical insurance. You may not control the surgery, but you can control how ready your body is for it. Number 4. Every pill you take matters. Review your medications deeply. At age 70 plus, most people are on 5 to 10 medications or more. Some of these can interact dangerously with anesthesia or post-op drugs. Others increase the risk of bleeding, confusion, or kidney stress. So before your surgery, sit with your doctor and review every single thing you take, prescribed, over-the-counter, or herbal. Especially pay attention to blood thinners like aspirin, warfarin, clopidogrel. Anti-inflammatories like ibuprofen or naproxen. Diabetes meds, they may need adjustment due to fasting. Sleeping pills or sedatives increase risk of post-op delirium. Supplements like ginkgo, garlic, or fish oil, they thin the blood. Don't stop anything on your own. Always work with your doctor. Ask for a geriatric pharmacist if possible. They specialize in how older bodies react differently to drugs. You must enter surgery with a clean and safe medication plan. Anything missed here can affect your heart, brain, and recovery. Number 5. Your support system is not a luxury, it's a necessity. This is the most emotional and perhaps the most critical truth. Do not go into surgery alone. And do not try to recover alone. After surgery, especially at this age, your needs multiply. You may need help getting out of bed, help remembering your meds, help watching for infection signs, help when pain becomes too much. Too many seniors return home with no one there. They suffer in silence. And sometimes, they don't recover. Whether it's a spouse, adult child, friend, nurse, or neighbor, you need someone by your side. Even simple tasks like meals, bathing, or walking become challenges in the first week. If family isn't nearby, arrange home health care. Ask your hospital for temporary caregiver programs. Stay in a short-term rehab facility. Use senior community services. Don't let pride or guilt stop you. Asking for help isn't weakness, it's wisdom. You have spent a lifetime helping others. Now, let others return that love. After 70, every decision matters more. Your time is precious. Your body is sacred. And your life is still very much worth fighting for. Surgery may be a test, but it's also a second chance. So remember these 5 truths. Your mind is your medicine. Your food is your fuel. Your preparation is your power. Your medications are your map. And your people, they are your protection. Healing isn't just physical. It's spiritual. It's emotional. It's a journey. And you don't have to walk it alone. After surgery, how seniors can recover faster and avoid dangerous complications. You've made it through surgery. But now comes the real challenge: recovery. For seniors over 60 or 70, this phase is crucial. A few right steps can bring healing. A few wrong ones can cause complications. This isn't just about medication or diet. It's about the heart, mind, and body all working in harmony. In this video, we'll walk you through the full roadmap: how to recover faster, stronger, and safely, and how to avoid setbacks that could be life-threatening. Point 1, the first 72 hours, a critical window. The first 3 days after surgery are like walking a tightrope. Why is it so risky? Your body is vulnerable. Pain and medications can cloud your mind. Infections can start silently. Mobility is low, increasing blood clot risks. Seniors may experience sudden confusion called delirium. So what should you do? 1. Have someone with you. Never be alone during these first days. A family member or trained caregiver must be present. Not just to help but to observe. 2. Watch for silent complications. Fever could be infection. Swollen legs could mean a blood clot. No urine for 12+ hours could be kidney trouble. Sudden confusion could be delirium. Don't dismiss these signs. Early action saves lives. Point 2, breathing is healing, lungs need love. After surgery, shallow breathing is common, especially if there's pain in the chest or abdomen. But shallow breaths lead to lung infections, even pneumonia. Recovery tip: use an incentive spirometer, a breathing device. Take deep breaths every hour even if it hurts a little. Cough gently to clear your lungs. Sit upright as often as you can. Don't lie flat for long hours. Think of every deep breath as a mini therapy session for your lungs. Point 3, your mind matters, avoiding post-surgery delirium. One of the most underdiagnosed complications is delirium, sudden confusion after surgery. It affects up to 40% of older adults. It can look like hallucinations, disorientation, agitation, forgetting where you are, acting like a different person. Why it happens: strong pain meds, sleep disruption, anesthesia effects, hospital noise and stress, infections or low oxygen. How to prevent it: keep the room calm and well lit during the day. Maintain a sleep schedule. Limit sedative medications. Speak calmly and often with the patient. Bring familiar objects like photos or favorite books. And most importantly, reassure them. Their brain is healing, just like their body. Point 4, move early, move gently, but move. Movement is medicine, especially after 60. Staying in bed too long can cause blood clots, muscle wasting, bed sores, constipation, depression. Gentle steps to recovery: sit on the bed edge within 24 hours. Stand with support, even for a few minutes. Walk with assistance as soon as allowed. Do leg pumps and ankle circles in bed. Every step you take is one step away from complications. 5, food is your pharmacy, but eat wisely. After surgery, your body is like a construction site. It needs raw materials to rebuild. Best foods for recovery: protein, eggs, fish, tofu, yogurt. Fiber, whole grains, fruits, vegetables to avoid constipation. Healthy fats, olive oil, nuts, seeds. Hydration, 6 to 8 glasses a day. Foods to avoid, sugary treats weaken immunity. Fried foods cause inflammation. Alcohol slows healing and interacts with medications. Pro tip, ask your doctor if you should take a multivitamin, probiotic, or iron supplement. Food is not just fuel, it's healing. Number 6, watch your wounds. Silent infections are deadly. Your surgical wound tells a story. Watch it closely. Call your doctor immediately if you notice redness spreading out from the wound, pus or unusual discharge, bad smell, fever, increasing pain. Always wash your hands before touching the area. Keep the dressing clean and dry. Check the wound twice a day. Use a mirror or ask someone if needed. Number 7, medications. Take right, ask questions, never guess. After surgery, you may be on painkillers, blood thinners, antibiotics, sleep aids, anti-nausea meds. Mistakes here can cause bleeding, constipation, confusion, falls, overdose. Safety tips: use a pill organizer. Write down every med and when to take it. Avoid alcohol or new supplements. Ask about side effects. Never skip blood thinners unless the doctor says so. Make your medication routine a ritual with care, attention, and a little notebook. Number 8, your heart needs more than pills, it needs peace. Stress is toxic after surgery. Fear, loneliness, regret, worry, these emotions weaken your immune system. They disturb your sleep. They slow your healing. So while you rest your body, also rest your soul. Emotional recovery tips: listen to soft, calming music. Watch nature videos or peaceful shows. Pray or meditate, whatever calms your mind. Call friends and talk. Connection is medicine. Write your thoughts down in a journal. Ask for hugs. Yes, they help. The body heals better in peace. Number 9, rest is a weapon. Don't underestimate sleep. Sleep is when healing accelerates. But after surgery, seniors often have trouble falling asleep. Frequent waking. Nighttime confusion. How to improve post-surgery sleep: avoid caffeine after 2 p.m. Stick to a sleep schedule. Limit screen time before bed. Keep your room quiet and cool. Use gentle lavender scent or soft music. Ask the doctor for non-sedative sleep aids if needed. Let sleep do its work quietly, slowly, powerfully. Recovery is not just about stitches closing. It's about the soul breathing again. Every breath you take. Every calm night. Every spoon of healing food. Every loving hand that helps you sit up or take a walk. It's all part of the recovery. You've been strong your whole life. Now it's time to be wise. You deserve to heal fully, not just survive. Follow these steps, and your recovery won't just be faster. It will be beautiful. Thanks for watching. Don't forget to subscribe for more timeless wisdom. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Reading your comments give us great motivation and encouragement. If you enjoy this video and found it helpful, please like, subscribe and share. Thank you for spending these moments with us. Stay strong, stay wise.